Hi everybody, Dr. Dan Rubin here with Dr. Amy Waite again on another super ad hoc with the doc. As you know, ad hoc means right now and for a particular purpose, and this is indeed for a particular purpose. At lunch, we discussed a study that was published last week on total sperm count and sperm concentration in males over the last, however many years?
1973 to 2011.
And what happened?
Total sperm counts decreased by 59%.
That's huge. There's been an argument, are sperm counts in the U.S. really decreasing? And so these are males who were not selected for fertility, but they were just selected to see. There was a 59% decrease over that year, so that's almost 2% a year.
Right.
That has big implications. I'd say it's beyond just whether or not we can have, what types of babies are men still of good reproductive age, in these years, in more modern times, but there's genomic implications. This study was published in the journal Human Reproductive Update, July 25th. And some of the implications here, which we found of particular interest, was not only male fecundity, but overall total sperm count can predict all-cause mortality and morbidity. That's big. That's big. That means that the lower your sperm count, the more chance you have of either dying of something or of getting a disease. Some type of disease, not necessarily reproductive disease. And you see men coming to your practice who have, or a complaint is low sperm count or reduced fertility, and it's, in the past, low fertility seemed to always be blamed on the female. Mm-hmm. But in recent years or recent decades, it's been looked at as a male problem too, and you treat these men.
I do. I see low sperm count all the time, and sometimes it's related to low testosterone levels, which we talked about last week on ad hoc with the doc. They're also declining, but it doesn't necessarily have to coincide with low testosterone levels.
Here's the big one. This is the real big finding. This is why we got on here to talk to you guys today. And listen closely, especially if you're a potential patient or you know somebody who has low sperm count, is having trouble with it. Because right now at our clinic at Naturopathic Specialists, if you're a new patient, you have questions about low sperm count for you and you want to become a patient, we can offer a free 10-minute chat about the types of treatments that you offer and how your practice is built around that. But here's the big finding. They're saying here that one of the implications of this study is that sperm count and other semen parameters have been associated with multiple environmental factors, including endocrine disrupting chemicals, which we're surrounded by.
Right.
You almost can't get away from them, but you have to consciously try. Pesticides. I mean, welcome to Pesticideville. I mean, we know that certain pesticides absolutely cause cancer, and we know without question that they disrupt the endocrine system. And other lifestyle factors, including diet, stress, and metabolic index. But that's a big part of your practice too. Talk about that for a little while, if you will, about what you do.
It is. So a lot of patients aren't used to this approach. So what we do is we have a long, lengthy intake, and with that intake we discuss with our patients. We talk about diet, we talk about nutritional deficiencies, we talk about all of the chemicals that they might be exposed to on a day-to-day basis, and although they can't avoid all of them, they can avoid a large number of them, and even I find that them just being able to avoid what they can, their sperm counts can rise.
I mean, I know that you have tremendous success in helping to detoxify people, improving symptoms, not just sperm counts, but I mean, I interact with you and I see similar, people too in the clinic, but your work is wonderful, and I think we just wanted to tell you about it because this is a huge publication, and conventional medicine really isn't doing what we're doing to address it, and so it can be addressed now, and it is. So that's basically it. If you want to read the study, it was, like I said, it was published in Human Reproduction Update on July 25th.